Hi everyone and welcome to our lesson for this week, and our lesson would be your flagellates. So just like your amoeba, which are identified based on their locomotory organ, which is your pseudopods, your flagellates are named after their main locomotory organ, and that would be the flagella. Okay, so we'll be talking about their morphology, their life cycle, and also the pathology behind each pathogenic parasite. So here are the learning objectives for this module. So just like the other modules that we discussed or topics that we have discussed, it is very important to acknowledge the pathogenic diseases or the diseases in general that are associated with our pathogenic parasite. We also need to discuss at least to identify which are the infective stages or morphological stages behind every life cycle of our parasite, and also explain the prevention and control of infections, especially the pathogenic ones. So here is the parasite classification under the subkingdom Protozoa. So as you can see here, we're done with the amoeba, and now we are moving on to the next class. We have the Zoomastigophora. Your class Zoomastigophora is divided into two types. We have the flagellates and the hemoflagellates. Although these two types are very similar in a way that their locomotory organ consists of your flagella, okay? But they are also divided based on the location that they are causing, or kung ano yung pathology behind their particular disease, okay? So we have your flagellates, which is divided into intestinal and extra-intestinal flagellates. Next, we have the hemoflagellate based on the prefix hemo. So that means they are mostly, okay, your blood and tissue flagellates. So before we start, I highly suggest that you use our outline or handout that I have sent to you last week, so that you can easily navigate our discussion for this particular topic. So the first video will be discussing the intestinal and extra-intestinal flagellates. So fortunately, under your class Zoomastigophora, only your Giardia intestinalis, or sometimes called Giardia lamblia, and Trichomonas Vaginalis are the pathogenic parasite among your intestinal and extra-intestinal flagellates. So let's go to the morphological form. So just like your amoeba, your flagellates may have the tropozoite form, which is probably the most common one, especially in your Trichomonas species, no? So your tropozoite contains your median or parabasal body. So ito yan. So this blue part here, although it's not important or necessary to memorize the function of these particular organelles, but it's important because, especially on their appearance, they may have different types, and that could lead or help us in identifying them under the microscope. Okay, so your median or parabasal bodies, this is used for metabolism, energy, and support. So very general yung kanyang function, and there are not much details regarding these particular functions. Okay, let's move on to the flagella. So your flagella are these particular hair-like extensions, okay, surrounding our tropozoite's body. So normally your flagella may have multiple flagella or locomotory organ around their body. So as much as 6 to 8, okay? I believe hanggang 6 yung maximum, no? But there are cases that they may have multiple or increased flagella, okay? So this is basically for motility, and this is the one that is the identifying feature for our flagellates, okay? Kaya sila tinawag na flagella because they contain this type of locomotory organ. Next, we have your axostyle and axoneme. I believe nabanggit din ito sa ating amoeba, no? So this serves as structural support dun sa kanilang tropozoite. Okay? Parang in humans, these are your vertebral column, okay, or spinal cord, or sorry, the vertebral column. So these particular structural support helps in the movement also, and the proper moving or proper movement of our tropozoites in your flagellates. Okay? So most of our tropozoite may also contain what we call the cystosome, no? Etong part na to. And of course, these are not visible in a regular microscope, no? Pero in-indicate siya ni Zabig, okay? Or what we call the cystosome. This is the mouth of our flagellates, okay? For eating and phagocytosis. Next, we have the costa. The costa is the green part here. So this particular structure connects your undulating membrane and the body of the parasite. So where is the undulating membrane? So ito yan, this tissue part here, okay, that protrudes outside the body of your tropozoite, that is your undulating membrane. And some of our parasites may contain, okay, a smaller undulating membrane. So one of these particular structure may also help us in diagnosing or identifying the different species under this particular class. Okay, so this is also for movement, the undulating membrane. So when it comes to the cyst forms of our flagellates, these are not numerous, no? So most of the time for intestinal flagellates, these are the infective stage of our parasite, okay? Because remember, sinabi ko nga, when it comes to intestinal life cycle, they need these particular forms to protect themselves from our gastric juices, especially present in the stomach. So nagkakaroon ng infectivity or protection rather of their species, okay, through this particular cyst. When it comes to the structural characteristics of this form, there is not much difference or importance when it comes to their structures or organelles, okay? So walang masyadong ginagamit na characteristics regarding this morphological form. So now let's move on to the lesson proper, no? So for our pathogenic flagellates, we only have two among your intestinal and extra-intestinal. So let's start first with the Giardia Lamblia. So your Giardia Lamblia is also known as your Giardia intestinalis, Giardia duodenalis, or also known as Trichomonas intestinalis. So here are all the other names of our parasite, but for the sake of uniformity, we'll be using your Giardia Lamblia as the most common name. So your Giardia Lamblia is the only intestinal flagellate that is pathogenic to humans, okay? That usually causes diarrhea, okay? Yun yung pinaka-common symptoms or pathology ng ating particular parasite. So, based on the location itself, alam na natin kung ano yung mode of transmission niya, no? So, intestinal kasi yan. So, most of the time, the mode of transmission for this particular parasite is through ingestion of contaminated food and water, okay? Just to give you a brief eye view of what your Giardia Lamblia may look like, especially for tropozoite form, eto siya. So as you can see, they are really small in nature and they have bilaterally symmetrical appearance. So kung ano yung itsura niya on the left side, may also the same on the right side, or what we call the bilateral symmetry, okay? So your Giardia Lamblia is cosmopolitan in nature, especially yung kanyang cases. So that means these particular cases are usually seen worldwide. Okay? But most of the time, according to other sources, when it comes to the demographics, adult men and children have more cases than other demographics. So later on, once we go through your pathology, we'll be explaining why this particular demographic are more affected than the others. So just like what I have said a while ago, your flagellates may contain 1 to 2 morphological forms. So for Giardia Lamblia, they contain 2 forms, and the first one we have the tropozoite. So this is the motile form of our parasite, and this is shaped as pear or teardrop, which is very similar to most of our flagellates actually. So ito yung itsura niya and under the microscope. So it's shaped as a pear, and it has a characteristic of a falling leaf motility. For Belisario, tinawag niya din tong erratic tumbling motion. So later on, we'll be showing you this. But this is the most diagnostic characteristic of our Giardia Lamblia. So these are usually seen in your direct fecal smear, okay, within 30 minutes. So I highlighted within 30 minutes because Okay, after 30 minutes or for a very long time, these parasites, especially the tropozoite one, disintegrate, okay, or die in the process. So the motility may not be observed by the medtech should he or she fail to view the particular stool sample within the 30-minute period. So one of also the characteristic of our Lamblia is the presence of a bilaterally symmetrical organelles. So as you can see here, especially yung nucleus nga, it contains two nucleus which are positioned symmetrically with each other. So some textbook also note this appearance as an old man with glasses. Mukha bang old man with glasses? So kayo nang mag-imagine yan, no? So also take note other organelles that may be present is the presence of your sucking disc. So this is very unique to our Lamblia, okay, the presence of sucking disc, and this is the one that causes pathology to our human host, okay? So this is for attachment, especially in the intestinal mucosa of our host, or especially the human host. So here is the picture of our tropozoite, no? Although very the same, take note of the bilaterally symmetrical organelles. Okay, just like yung kanyang nuclei na very positioned on the same level, okay, with each other. And also kahit yung kanyang position ng flagella nila, okay, parehas lang din. So in this video, as you can see, this is the falling leaf motility, which is characteristic of our Lamblia. So according also to Belisario, this is also described as erratic tumbling motion. Ayan, that is your falling leaf motility for Lamblia tropozoite. So here is the cyst form of Lamblia. So although there are not much clinically significant characteristics that we can use to differentiate this form to other cyst forms of non-pathogenic origin, take note of the presence of our football shape appearance, okay? Just like here on this picture, so mukha siyang football and it contains 4 nuclei in total. So yun yung pinaka-maximum nuclei that your Lamblia may contain, which represents the maturity of our cyst, okay? Or what we call the quadrinucleated cyst. Take note also the interior flagella that are present inside the nucleus. So here is the life cycle of Lamblia. So the mode of transmission is through ingestion of contaminated food and water. Usually this food and water are contaminated with human feces. And most of the time, the only morphological forms that infect human is what we call the cyst form. Okay? Sir, how about the tropozoite form? Will they be able to infect the human host? The answer is no. So as I have said a while ago, the cyst form or the tropozoite form rather usually disintegrate and die outside the environment, okay, or outside the host, okay? And even if we ingest the tropozoite accidentally, these particular morphological forms die in the presence of gastric juices, okay, in the stomach. So only the cyst form is the infective stage or the stage that survives within those scenarios. So the target organ is small intestine, okay, especially the layers, duodenum, jejunum, and upper ileum. Especially in the duodenum, this is the part where the excistation happens. Again, when we say excistation, this is the process of, okay, binary fission of your nuclei inside your cyst. So, nagkakaroon ng binary fission where according to certain references, one single cyst can create 8, okay, tropozoite. And this particular tropozoite will eventually invade the small intestine, okay, either of these layers, and cause pathology, which later on we'll be discussing. So again, the infective stage is the cyst form, and the diagnostic stage would be cyst and tropozoite. But remember, for tropozoite, within 30 minutes, we should be analyzing and viewing these particular forms in the microscope. So here is the simple life cycle of Lamblia. So again, the mode of transmission for this parasite is through eating or drinking contaminated food and water. So the infective stage or infective form of our parasite would be the cyst form, where upon ingestion by the host, it will be dislodged on the small intestine. So this is the target location of our parasite. So upon reaching the small intestine, your cyst forms will undergo excistation, where nuclear division will be evident. Upon nuclear division, it will create multiple copies of tropozoites. So these tropozoites will feed on the intestinal mucosa by attaching their sucking disc. So that is the main pathology of our parasite, no? So this is where competition of nutrients against the host. Okay? So sometimes or most of the time, the host exhibit malnourishment, especially for chronic stages of this particular parasite. So after a while, once the tropozoite travel down to your large intestine, the yellow one here, they will exhibit encystation, en. So usually here on this particular form or area rather, they will again go back to the original form, your cyst form, so that once they are released in the stool sample, they can be infective again to other suspecting hosts. So here is the main pathology of Lamblia. So this is called Giardiasis, and this is a significant but not life-threatening gastrointestinal disease. So just like your other gastrointestinal parasite, this disease is associated usually in forms of diarrhea and other gastrointestinal discomfort. So what happens here is that your tropozoites, the motile and the feeding stage of the parasite, attaches their sucking disc to the mucosa of the host, especially in the duodenum of your small intestine. So what happens here is that they feed and compete with the essential nutrients by the host. So upon attachment to the intestinal, your Lamblia tropozoite will cause alterations in the villi, such as your villus flattening and crypt hypertrophy. So nagkakaroon ng flattening under this area, and of course the enlargement of our crypts surrounding the tissues of your small intestine. So this alteration will lead to decreased electrolyte, decreased glucose and fluid absorption, and disaccharide deficiency. So basically, nagkakaroon ng decreased nutrients or absorption of nutrients due to the presence of your Lamblia tropozoite attached to your intestinal mucosa. So for acute cases, patients experience abdominal pain described as cramping associated with diarrhea. There's also excessive flatus with an odor of a rotten egg due to the hydrogen sulfide production or H2S production. Other clinical features include abdominal bloating, nausea, and anorexia, especially in children, or what we call the failure to thrive syndrome. Here on this number 2. Okay, this is where children exhibit malnourishment due to the lack of nutrients that are being absorbed in their small intestine. So diarrhea is the most common symptom, occurring in almost 89% of the cases. It is followed by malaise or general discomfort all around the body, especially in the intestinal area, and flatulence. Spontaneous recovery occurs within 6 weeks in mild to moderate cases. In untreated cases, unfortunately, patient may experience diarrhea with varying intensities that usually lasts for weeks or even months. So when it comes to the chronic infection of your Giardiasis, this is characterized by steatorrhea or bloody diarrhea in layman's term, or the passage of your greasy and frothy stools. So in some cases, periods of diarrhea have been observed to alternate with normal or even constipated bowel periods. So there may be weight loss, profound malaise or general discomfort, and low-grade fever. So in developing countries, it has been described as the cause of failure to thrive syndrome, just like here, especially for children. Other forms we can also associate with Giardiasis is what we call the gay bowel syndrome. This is the diarrhea, caused by your Giardiasis associated with men, especially gay men who practice unprotected sex, So next is also your traveler's diarrhea, which is also another diarrheic infection caused by Giardiasis upon ingestion of contaminated food and water, especially outside the country, especially when the patient or the suspected person traveled to a country with a very low or very poor sanitation of food and drinks. So for your Giardia lamblia, we diagnose this particular parasite through stool sample. So the specimen of choice is stool. This is the most common one and easy to acquire sample. But you can also use your duodenal aspirate by your entero test. So later on, we'll show you the entero test that we are talking about. But the common procedures that we do for your stool sample would be the direct fecal smear, where most of the time we highlight the motility of your tropozoid. So we are looking for the falling leaf motility of your Giardia lamblia tropozoid within 30 minutes under your microscope. We can also use your concentration techniques to assess the intensity of the infection. Diagnostic procedure where we can safely identify or accurately identify your parasite is through different types of immunological and serological testing, such as your direct fluorescent antibody assay and immunochromatographic assay. So here is the simple entero test or string test for the aspiration of your duodenal fluid. So usually the patient is given a capsule or gelatin capsule with a string attached to the cheek of the patient after swallowing for safety purposes. So after 4 to 6 hours, the physician will extract by pulling the string, okay, and all the juices or all the fluid that are attached to the capsule will be examined through the direct fecal or direct smear, okay, of fluid analysis. So usually we check here for the presence of your tropozoid or the motile tropozoid. So for treatment and prevention, the drug of choice would be metronidazole, and the prevention is, since this is intestinal or under our fecal oral route mode of transmission, proper sanitary of and disposal of human feces or excreta is the best way to prevent contamination of food and water supply. So we're done with Giardia lamblia. Now let's move on to Trichomonas vaginalis. So compared to your Giardia, your Trichomonas vaginalis is considered an extra-intestinal pathogenic parasite or flagellate. So your Trichomonas vaginalis is the most prevalent non-viral sexually transmitted infection. So based on the description itself, the mode of transmission for this parasite is through sexual intercourse. So this is the only well-studied pathogenic extra-intestinal flagellate which has a 170 to 190 million cases worldwide. So cosmopolitan, which means worldwide, and associated from people with multiple sex partners and commercial sex workers. So remember, when it comes to morphology, all Trichomonas species do not have a cis stage. No? I believe I discussed this already in our previous discussion on amoeba that most of the time for parasites, they usually undergo cis form to protect their species, especially once these particular species are dislodged in your stomach region. Okay, remember your stomach area or region is very acidic in nature, and it's very detrimental or destructive to the species of your parasite. But since Trichomonas vaginalis is not or do not undergo intestinal route, your parasite do not create the cis form. So again, just like we discussed a while ago, your Trichomonas do not have cis form. So only the trophozoite are described in this particular scenario. So the trophozoite is a pyriform or pear shape, and the most diagnostic characteristic that we need to look out for, especially under your direct fecal smear, would be the corkscrew, rapid jerky, or quivering motility of their trophozoite. So upon checking in your microscope, we have to look out for this particular motility of your Trichomonas vaginalis. So other information regarding the morphology will be for you to read, especially you have your outline already. So kindly take note of those other important characteristics. But again, the only highlighted here is the most important one, the motility. So this picture is from Zapig. So as you can see, kindly take note also of the presence of a undulating membrane. Only covers half of the body length, just like here on this particular picture. So only half of the body length is covered by your undulating membrane, and the presence of granules along the axostyle is very common, just like here on this picture, the brown spot surrounding the axostyle of the parasite. But again, the most characteristic would be the motility of the parasite. So here is the motility that we are talking about. So this is a corkscrew, rapid jerky or jerky motility. Sometimes in Belisario, he described this as quivering, or in Tagalog, nanginginig, na motility. So as you can see here, very distinctive for Trichomonas vaginalis. So here is the life cycle of your Trichomonas vaginalis. So this parasite is usually found in the urogenital tract of patient. For women, this is more commonly associated or found in the vaginal area, but may also extend as far as the renal pelvis. So for men, they are more isolated in your urethra, but less commonly may also be found in your epididymis and in your prostate. So the infective and diagnostic stage for our parasite is the tropozoite form. So here is a simple life cycle for our Trichomonas vaginalis. So again, the infective and diagnostic form would only be the tropozoite form of the parasite. So this tropozoite inside our urogenital tract undergoes multiple or multiplication by longitudinal binary fission to increase their species. This particular parasite usually are only located in this particular area, the urogenital tract. Outside the urogenital tract, especially if accidentally this parasite are dislodged in other areas, they usually do not survive in the process. So the pathology behind your Trichomonas vaginalis is what we call your Trichomoniasis. So this is also known as your ping-pong's disease due to the recurrency of, or the possible recurrency of, signs and symptoms that are felt by the patient. So the ping-pong's disease here is due to the improper treatment of both sexual partners. That's why it's very important that it's not only the person infected with trichomoniasis that should be treated. They should be both treated with trichomoniasis, because sometimes male may also harbor the parasite but produces no signs and symptoms. So your trichomoniasis may be associated or may be described as having inflammation. For women, this is persistent vaginitis or inflammation in the vaginal mucosa. For men, although they are asymptomatic or what we call the silent carriers, they may also exhibit inflammation within their urethra. So for women, trichomoniasis is manifested by persistent vaginitis, and it is divided into acute and chronic stage. So after 4 to 28 days, the parasite will cause degeneration and desquamation of vaginal epithelium. Behind this or followed this, your leukocytic proliferation will be evident. So when we say leukocytic proliferation, so that means the white blood cells are already proliferating the vaginal mucosa, causing inflammation as well. So the acute inflammation caused by the parasite results in greenish or yellowish vaginal fluid, and with this particular symptoms may cause intense itchiness and burning sensation of the patient. So as the acute condition changes to the chronic stage, the secretion loses its purulent discharge or appearance due to the decrease in trichomonas and white blood cell. So usually for this patient, increased slapping off of epithelial cell may be evident because of the decreased integrity of your vaginal mucosa. Patient may also experience vulvulitis or inflammation within the vulva and painful urination or what we call dysuria. So since there is a imbalance of good and bad bacteria within the vaginal mucosa, patient may predispose themselves to secondary bacterial infection. So in cases of speculum examination, 2% of the cases may present with having a strawberry cervix, just like here on this picture, for Trichomonas vaginalis infection. So, Trichomonas infection in males may be latent and essentially asymptomatic. So, in some cases, they can still experience inflammation within their urethra, especially for a patient with low immune system. Normally, this particular patient may exhibit dysuria or painful urination and increase urine output during the night. So the most common form of, or complication rather, of persistent urethritis in male is prostatitis or inflammation of the prostate. So for the diagnosis of your Trichomonas vaginalis, the specimen of choice would be urine and other secretions concerning your urogenital tract. So it may be urine, vaginal, urethral, and prostatic secretions. So either of these particular fluid may be used in the analysis of our tropozoites regarding your Trichomonas vaginalis. The common procedures is the basic saline preparation where we smear fluid secretions within or at the top of your glass slide with 1 drop of saline and view under the microscope. Normally, we check on this particular procedure the motility of the tropozoite, and that would be the jerky motility appearance or the observance under the microscopic examination. We also sometimes do staining for your glass slides to preserve the morphology of the particular parasite. This is for future references and studies. So diagnostic procedure would be culture. This is the gold standard for the identification of our Trichomonas vaginalis. And this is very helpful, especially if there will be delay in specimen analysis, because most of the time, after a few hours, your Trichomonas tropozoite will die within the fluid secretion. So it's very important that we can preserve as much as possible, okay, by using culture media. So here is an example of a culture media. This is a broth culture. Pag sinabi natin broth culture, this is a liquid form of agar or of fluid. Okay, these are usually created to preserve, okay, the life expectancy of a particular organism, especially parasite. So normally here we drop 1 urine specimen or any kind of fluid specimen, and then the this kind of broth will provide food and other nutrients for the growth of our parasite. So in this particular scenario, the culture media that we use, we have your diamonds modified medium, or sometimes we also use your Feinberg and Whittington culture medium. So either of the two can be used to preserve the life of our parasite. And then after a while, after letting the parasite grow, we can extract a fluid directly from this particular broth and then view under the microscope using our saline preparation. Other diagnoses that we can use for the identification of Trichomonas vaginalis would be pap smear, PCR or polymerase chain reaction, and the in-pouch TMTV test. This is the in-pouch TMTV test. This is a directly basically a pouch where we can drop a sample of your vaginal or other secretions in concern with the urogenital tract, and we can directly view the pouch using a microscope. This usually contains a fluid that is rich in nutrients to preserve the motility of our tropozoites. So for the treatment and prevention, the drug of choice is metronidazole or tenizazole. And the prevention is limiting the number of sexual partners and, of course, proper use of protective devices such as condoms. It's also very important for partners to be faithful and at the same time be knowledgeable if they are engaging in multiple sexual activities. So actually, we're done with our lesson for the pathogenic intestinal and extra-intestinal flagellates. So for the non-pathogenic flagellates, I highly suggest that you do further reading with this particular parasite, but they are not much clinically significant, especially in our subject for medical parasitology. The most important characteristic that we need to highlight here is their morphology, because sometimes this particular parasite, the non-pathogenic flagellates, may be confused with the pathogenic due to the usual similar appearance from the pathogenic ones, your Giardia and Trichomonas vaginalis. So let's talk about each one of them. So the first one is Trichomonas hominis, and this is considered a human and primate intestinal parasite. So this is still under the genus Trichomonas, and this is a non-pathogenic Trichomonas species. So that it does not cause any kind of disease, okay, only for those people with low immune system. And of course, if that is the case, people usually exhibit, okay, diarrhea-like infection since this is intestinal in nature. So the prevalence rate for the Philippines is less than 1%, so quite rare, and children are more susceptible in contracting this infection or parasite. So just like your other Trichomonas species, your Trichomonas hominis only contains the tropozoite form. So their tropozoite appear as pyriform or pear-shaped, and they contains or they exhibit a nervous and jerky motility. It contains a single nuclei, just like here on this picture, and it contains 6 flagella. Okay, one flagella is what we call the trailing flagellum and is attached, okay, below or the posterior area of the parasite. But what is the most important characteristics of this tropozoite form for Trichomonas hominis is the presence of a conical cystosome cleft. Again, cystosome is the mouth. So as you can see here, there is a cleft or a parang in Tagalog sira or a cleft part in their mouth area. So that is diagnostic for this particular parasite. So when it comes to the life cycle of our Trichomonas hominis, the mode of transmission is through ingestion of contaminated food and drink with tropozoite. So if you're asking, sir, this is tropozoite. So as you have discussed, tropozoite are very sensitive to harsh environments such as the stomach pH or the acidic pH of our stomach. So since this is tropozoite, what is the reason how they can safely pass the stomach area of the host? According to the book, although this is not well studied, drinking of contaminated milk, which is associated with children, gives immunity to the tropozoite by neutralizing the acidic pH of our stomach. So within that span of time, the tropozoite can easily or safely pass the stomach area of the host without getting destroyed. So the target organ is the large intestine where binary fission is evident. So the tropozoites will cause, okay, or sometimes will not cause any kind of disease since this is non-pathogenic. But for people with low immune system, they will exhibit your Giardia-like infection. So very the same with Giardia, with having gastrointestinal disease or infection. So the infective stage is tropozoite and the diagnosis stage is still tropozoite. So for the life cycle of your non-pathogenic flagellates, so these are very the same with your Giardia lamblia, but the only difference is that they cause non-invasive colonization. Pag sinabi nating non-invasive colonization, so they do not cause any kinds of signs and symptoms or disease themselves. And they usually safely pass within the gastrointestinal tract and be secreted in your feces. Next is your Trichomonas tenax. So this is also considered a non-pathogenic flagellate. So your Trichomonas tenax is considered a non-pathogenic mouth flagellate. So this is still under the genus Trichomonas and it occurs all throughout the world and usually patients with poor oral hygiene are susceptible. When it comes to morphology, this is considered the smallest Trichomonas among all the Trichomonas species. So at around 5 to 12 micrometers, and they are still pyriform in shape with motility not being described in the books. Okay, and it contains a single nuclei, usually located at the center of our flagellate. And take note of the undulating membrane with 2/3 of the body length. So as you can see, the undulating membrane almost cover the whole body of the parasite. So the mode of transmission for Trichomonas tenax is through exposure to droplet spray from the mouth. This is acquired through kissing and also usage or sharing of contaminated dishes or plates and drinking glasses. So the target organ is the mouth and the infective stage, since this is Trichomonas, only the tropozoite form. So when it comes to the diagnosis, the only specimen that we can acquire is the oral scraping, since this is the mouth flagellate. Other specimen or location that we can use is generally the whole mouth, such as the tartar between the teeth, the gingival margin, and the tonsillar crypts, at the back of our mouth area. So we're done with your Trichomonas tenax. Now let's go to Chylomastix mesnili. So your Chylomastix mesnili is very different in a way that this is an intestinal flagellate that usually has two morphological forms, the regular cyst form and the regular trapezoid form. So the prevalence rate here in the Philippines is less than 1%, and it prefers warm climates, okay, to propagate their species. So for the morphology, the most important thing to highlight here is the presence of a spiral groove. Ito siya, okay? According to the book, it has no function, but the presence of this may be diagnostic for this particular parasite, your Chylomastix mesnili. It was also mentioned in the book that it contains or it exhibits a boring spiral rotary forward movement. Unfortunately, we don't have any videos with regards to this since this is not well studied. So here is a example of a picture of our Chylomastix mesnili. So take note of a spiral groove, okay, cystosome with fibrils as well, and the curved posture, especially at the posterior area of the flagellate. So when it comes to the cyst form, it contains a clear hyaline nub, no, or what we call the nub-like protuberance, and it is shaped as pear or lemon. So here is a picture of our Chylomastix mesnili cyst. So this, since it has a cyst, this is also the infective stage of the parasite. So when it comes to the life cycle, this is through ingestion of cysts, okay, in contaminated food and drink. So this is fecal, oral, en route, where feces contaminant may be evident. So the target location is the large intestine, where it usually do not cause any kind of signs and symptoms. Infective stage is the cyst, and the diagnostic stage would be both the cyst and trapezoid. Okay? As you can see on your outline, there are other non-pathogenic flagellates that I also included. So kindly read those particular non-pathogenic flagellates, but these are not included in your Belisario. So that means that these are not medically important in our review as medical technologists. But I highly suggest that you read the other important facts behind or in your outline. So that ends our discussion for intestinal and extra-intestinal flagellates. So kindly go over to the second video for the blood and tissue flagellate discussion. Thank you and good day.